So this talk is about concepts in intravenous fluid therapy. Intravenous fluids are parts and parcel of a doctor's job. In pediatric practice, we use IV fluids in a wide variety of conditions. We use IV fluids when a child is in shock. We use IV fluids when the child is hypertensive. We use IV fluids when a child has got severe dehydration because of, let's say, gastroenteritis. We use IV fluids as maintenance therapy in certain conditions. Some of the burning questions around IV fluid concept is that what is the difference between all these different types of IV fluids that we use, like 5% dextrose, 0.9% sodium chloride, 0.5% sodium chloride, ringer lactate, plasma light. So what is the difference like? How do they differ from one another? Many times we talk about tonicity and osmolality of IV fluids. That this is isotonic, this is hypotonic, this is hypertonic. So what is meant by tonicity? And what is the concept of osmolality of these different types of IV fluids? We also need to know what is the distribution of the water in the human body. And if we give IV fluids, how are they distributed once you put them in the veins of a child? Then finally, we need to understand what are the clinical uses of the different types of IV fluids. So let's dive in and get started and talk about all of these. Now, different types of IV fluids. Some of the common ones that are used in practice is your 0.5% sodium chloride, that is half strength normal saline. You have got the full strength normal saline, that is 0.9% sodium chloride. Then we have got the 5% dextrose, we have got Ringer's lactate, we have got plasma light. So the difference in all these types of fluids is what is the components of these different types of fluid. Like sodium chloride, whether it's half strength or whether it's full strength, sodium chloride. So it would contain sodium and it would contain chloride. 5% dextrose would only contain glucose. Ringer lactates contains much more than what is contained in sodium chloride. So it not only contains sodium and chloride, but it contains potassium, it contains calcium, and it contains lactate as a buffer as well. Now here I want to clarify one thing. This lactate in Ringer's lactate is not lactic acid. That lactic acid that causes cramps when in the muscles, when there is a lot of production of lactic acid in the body, that is an acid. So it has got an hydrogen ion in it. It's basically an acid, while lactate itself is a basic buffer. So it's a base. This is the difference between lactic acid and lactate. So don't confuse this lactate with lactic acid. This is basically a lactate. This is basically a base. So the composition of these different types of IV fluids is based on what is contained within these fluids. So sodium chloride is just sodium chloride, dextrose just glucose, Ringer's lactate is sodium, chloride, potassium, calcium, and lactate. Plasma light contains all these things, but it doesn't contain lactate. It contains other things as a basic buffer. Now, there is a difference in the number of active ingredients or the solutes in these different types of solutions. Like, for example, if I start with 5% dextrose. Now, what is 5% dextrose? 5% dextrose, you've got 1 liter of water, and in that, you've got 50 grams of glucose. So that 50 grams of glucose basically gives an osmolality of 253 milliosmol per liter. Similarly, 0.9% sodium chloride, that contains 154 milliequivalents of sodium and 154 milliequivalents of chloride. So if you add them up, that becomes 308. So the osmolality of 1 liter of 0.9% sodium chloride is 308 milliosmoles per liter. If you take half strength, you just divide it by 2. So that would be 154. If you see plasma light has got, because it contains sodium, it contains chloride, it contains potassium, it contains calcium. So it has got slightly more osmolality, but that osmolality is the closest to the human body. So the human body osmolality is around like 280 to 308 milli osmoles per liter, and ringer lactate is around 273, 275. It's very close to the human body. Sodium chloride is also close, but it's slightly at the upper range with 308. So the osmolality depends on how much solute is there inside the these solutions. Now, how these solutions they distribute inside the human body depends on component inside that. Like for example, if you give a child 1 liter of 5% dextrose, you know the human body is composed of the intracellular compartment, that is the compartment inside the cells. So human body has got billions and billions of cells, which part take part in different, which are part of different tissues of the human body, and that make up the organs. So inside the cells is water, but there is water outside the cell as well. And outside the cell, again, we call it the extracellular fluid. Again, it has got further two subcompartments. One is the compartment between the cells, which is known as the interstitial space, and the other is a compartment which is inside the blood vessels. We call it the vascular compartment, and that part of water which is inside the vascular compartment is known as plasma. So if you give 1 liter of 5% dextrose, 2/3 of it would go inside the cell in the intracellular compartment. In other words, it means it goes inside the cell. It's dextrose, so like it's made up, so it will go inside the cells. It will take water with it inside the cells. So 2/3 of it would go in the intracellular compartment. 1/3 of it would stay outside the cells or in the extracellular compartment. Again, of that, you will see most of it would remain in the interstitial space, and very little amount would go in the vascular compartment. If you give 1 liter of half strength normal saline, which has got low osmolality, 154 or something, so what would happen? Around 33% of it would go inside the cell, while rest of it, that would be 67%, that would remain outside the cell. And again, big chunk of it would remain in the interstitial space. Some of it would go into the vascular compartment as well. But if you give 1 liter of now 0.9% sodium chloride, which is again sodium and chloride, it's the same as like 0.5%, only the strength is double, you would see that 75, 3/4 of it would remain in the interstitial space, while 1/4 would go in the vascular space. In other words, the whole of this fluid would remain outside the cells. Outside the cells, again, mostly in the interstitial space, some extent in the vascular compartment as well. So again, based on these differences, if you want that water to go inside the cells, you would be choosing something like dextrose 5% or 0.45% sodium. But if you want that water to remain outside the cells, maybe in the vascular compartment, you would be choosing either normal saline or ringer lactate, because they prefer to stay outside the cells. Why? Because of their tonicity, because of their osmolality, because of their composition. So let's talk further about these things, that when you give IV fluids, just talked about that some of it would go in the intracellular space, some of it would go into the, what decides that water goes inside the cells or water remains outside the cells? There are two terms here, osmolality and tonicity, and you need to understand these terms. Osmolality simply means how much stuff is there in that solution, how much solute is there in that solution. While tonicity simply means how good these solute keep the water outside the cell in the extracellular space. How good is the holding power of this solute to keep water with it. Remember, you can have the same type of osmolality, but in one type of osmolality, you will see those solute would not be able to hold water in the extracellular space. The same, with the similar strength, another solution that would be able to hold the water in the extracellular space. So tonicity is just like the quality of the osmolality. How good that solute is, how good is the holding power of that solute, that is tonicity. While how much is there in the fluid, that is osmolality. So tonicity of the fluid decides where the water goes, and on that basis we divide the fluids into either isotonic, hypotonic or hypertonic. So hypotonic solutions simply means that their solute doesn't have got that much good power to hold the water in the extracellular space. More of that water would go inside the cells, less would remain inside. It would lead to dilution. Hypotonic. Isotonic means it is more or less similar to the human body osmolality. So like whatever is the distribution of the water, it would keep that ratio almost similar in the human body. While hypertonic means it has got a lot of power to hold the water, so it would mostly draw water from inside the cells. It has got so much power that it acts like a magnet, and even that water that is inside the cell, even it will draw that outside as well. So remember, it's the fluid's tonicity which is equivalent to effective osmolality that actually determines how much water stays in the extracellular space. So hypotonic simply means more water goes inside the cells. Isotonic means remain it balanced inside the cell as well outside the cell. Hypertonic means it would draw the water out of the cells into the extracellular compartment. Now, let me explain how is the total body water distributed inside the human. Right from the very basic, lectures of physiology that we studied in the medical college, we were told that the human body is 70% water. 70% water. Now, this water, 70% water, two-thirds of this water is inside the cells. The human body is a big, sort of a mess of different billions and trillions of cells. And that cells, they contain water as well. Two-thirds of this water is inside the cell, but only one-third is outside the cell. And whatever is outside the cell, of that, 3/4 of that water which is outside the cells, that is within the interstitial space. Only 1/4 is there in the vascular compartment as well. So the IV fluids, they distribute proportionally across different body compartment based on their tonicity. Like if we talked about isotonic fluids. Isotonic fluids, they stay in the extracellular compartment. They only distribute between the interstitial and the plasma. So they would go from the vascular compartment into the interstitial and vice versa. So for example, if you give 1 liter of isotonic fluid, whatever, 75% of that, or in other words 750 mils, that would remain in the interstitium, while 25% would remain in the vascular compartment. Why this is this type of distribution? Because I told you that the human body water composition is such that of all the extracellular water that is there in the human body, 3/4 of it remains in the interstitial space, 1/4 remains in the vascular compartment. So if you give isotonic, the same distribution would happen. It would follow the natural distribution of the human body. So 3/4 or 75% or 750 mils, if it is 1 liter, would go in the interstitial space. 250 mils or 1/4 would remain in the vascular compartment. But if you give 1 liter of free water, let's say dextrose 5%, it's basically considered to be isotonic, but it is hypotonic because this glucose is metabolized. This glucose is converted into energy. What would happen? You give 1 liter of this 5% dextrose. Approximately two-thirds of it, which is 667 mils of that, would eventually move inside the cell. Why it is moving inside the cell? Because glucose moves inside the cell. It has to be metabolized. The human body actually uses glucose as a fuel for all the metabolic purposes. So the glucose goes inside the cells and it's taking water with it as well. The rest, 1/3, would remain in the extracellular space. And again, big chunk of that would remain in the interstitial space, while a little amount of that would remain in the vascular compartment. So that's why, let's say if somebody is in shock, somebody is in a hypotensive state and you want to give some fluid, you just imagine which fluid would you give. Would you give him normal saline, or would you give him ringer lactate, or would you give him 5% dextrose? Definitely you will give them 0.9% sodium chloride, because you know that most of it would remain in the extracellular compartment and at least 1/4 of it would remain in the vascular compartment. So that would bring the blood pressure back to the normal. That would address the shock. But if you give them 5% dextrose, it's going to go inside the cells. Still, by the end of giving those fluids, much of it would be inside the cell and it would not address the underlying issue which you want to address. And also keep it in mind that here we are talking about a normal, homeostatic mechanism, a normal physiological mechanism. Now, the distribution of fluids to some extent practically varies, because when you're giving it to a child, you're not giving it to a child who's normal. You're giving it to a child who is basically suffering from some underlying condition. So they might be having a widespread infection. They might be having some inflammatory process going on. So remember, the distribution of these fluids, that may vary inflammatory state. Why? Because there might be capillary leak. When there's capillary leak, when you're giving fluid, it still leaks into the intestine. Or there might be a hypoalbuminemia, hypoproteinemia that would lead to decreased colloid osmotic pressure. So some of these fluid distribution can vary according to the underlying disease conditions that the child is suffering. Then coming down to the uses of the IV fluids. So again, the uses of the IV fluids depends on their tonicity, whether they are isotonic, whether they are hypotonic, or whether they are hypertonic. Most common, in most of the cases we use isotonic. Isotonic fluids are common one used are your 5% dextrose, 0.9% sodium chloride, and Ringer's lactate, and plasmalite as well. So 5% dextrose in water, which is dextrose, you basically use it in certain conditions where you don't want to give sodium, like hypernatremic states. You want to give fluid, but you don't want to add extra sodium into the body. So you might be using 0.45% sodium chloride, or you might be using 5% dextrose. You can use it in dehydration and fluid loss, but it's not used basically as a first line. You can only use it if you haven't got any other choice, because most of this fluid would go in the intracellular compartment rather than stay in the extracellular compartment, and it just can cause fluid overload. So it has to be used very cautiously. The most common one is 0.9% sodium chloride. It's usually the bread and butter in a pediatric emergency medicine department. Use it in a variety of conditions. Use it in shock. You can use in hypernatremia to some extent, but most of the times we use it in shock. We use it in hypotensive states. We use it in resuscitation. So up to 1 or 2 liters can be safely given. Usually in kids, in a condition of shocks, we give like 20 mils per kg fluid boluses, and they can repeat it up to 3 times. But remember, sometimes it can lead to overload as well, because the pH of the 0.9% sodium chloride solution is 5.7. So if you give a lot of IV fluids, then obviously it would further aggravate the acidosis. Underlying acidosis can be aggravated. So if you have to use a lot of fluids and things, then after sodium chloride, it's better to change towards like Ringer's lactate or plasmalite. But isotonic 0.9% sodium chloride is the first line IV fluid for shock, hypotensive state, or in all those conditions in which we are doing resuscitation. It's also used like in initial treatment of diabetic ketoacidosis. Ringer's lactate is usually used as a perioperative fluid, because it contains not only sodium and chloride, it contains calcium, it contains potassium as well. It's usually the surgeon's most favorite fluid. Perioperatively, where a lot of fluid has to be given, Ringer lactate is the best choice. It is also usually given in burns patient, because burn patients are using a lot of, a lot of evaporation from the burns and other things. So they are losing lots, and there is exudation from the wounds as well. So they lose a lot of these sodium, chloride, calcium, potassium from their wounds. So that's why it has to be replenished. So Ringer's lactate is again a very good fluid choice in those kids who have suffered from massive burns. It is also very useful fluid in lower GI fluid losses, like somebody who's got like severe gastroenteritis. Again, after the initial resuscitation, uh, Ringer's lactate can be given. 0.45% sodium chloride is usually used as a water replacement. Want to you replace water? Obviously, you cannot give like pure water to a child, so you can use 0.5% sodium chloride. It can also be used sometimes in diabetic ketoacidosis, in certain protocols, and can be used in vomiting as well. Rest of the fluids, which are like hypertonic, which is 5% dextrose in normal saline, or dextrose 10% in water, they are used in specific conditions. So these are few of the common conditions in which we use different types of common IV fluids. Again, I haven't included all the different types of IV fluids because then the lecture would become a very prolonged one. I mean, I haven't deliberately included the hypertonic ones because I would probably cover them in a separate lecture. But remember, one of the most common fluids that we use are the isotonic, and it's usually 5% dextrose and 0.9% sodium chloride and Ringer's lactate. So you need to understand what is the differences between these types of fluids, what is the tonicity on osmolality, and what are the clinical uses of these different types of fluids. So remember, like, just if you have to summarize it in one sentence, most of the times in resuscitation, in shock, we always start with 0.9% sodium chloride. But if it is like stretched beyond limits, then mostly it is changed with Ringer's lactate. Though Ringer's lactate is primarily used in perioperative states and also in burns patients. Dextrose 5% is usually used in hypernatremia, or if somebody has got associated issues with glucose metabolism. So obviously you can use dextrose 5% that particular condition. This was a comprehensive short talk on the concepts in IV fluid therapy, and basically we touched on the differences in the common types of IV fluids that we used in clinical practice, and how the body water distribution works, and how these fluids are distributed, and what are the clinical usages of these fluids. So I hope you have liked this video. If you haven't subscribed to my channel, please do subscribe, and please share this video with your friends, and please do comment. If you like it, please comment. Even if you have got some question, you can put down your question in the comment section below, and I will answer them as soon as possible. So I wish you a very happy good day. Thank you very much. Bye bye.